Recording in progress.
Welcome to Dr. Simone's Mindspace. Today, a very on-the-road podcast with Anna, Dr. Anna, who you have already heard of before. We have been talking about different topics or we will talk about different topics in the future on fertility and infertility and the reproductive and post-reproductive cycle of us women. I might start with just a quick anecdote I think I've messaged you about when I was in New York now recently, how important women that just turned 40 feel the topic of perimenopause and menopause is. And everyone is sort of in agreement that it's a topic that hasn't been discussed very much. I know we haven't really talked about starting there, but I just wanted to highlight this to you because when you introduce yourself, you will probably mention it again, that is one of your biggest areas of focus and raising awareness as well. So yeah, the floor is yours.
Yes, hello everyone. Today will be a special day as well because I'm talking to you, but I'm traveling to Bern. So I was in Basel this morning and now I'm going to Bern. And yes, about your question, it is actually true that we are first in our 40s aware that the hormonal imbalance started earlier than the menopause itself. So, and not every woman feels the same. So some women will arrive until 50 and didn't have any symptoms, just have had their menstruation every month. And others start already with 40 or middle 40s with some symptoms that are bothering them very much. Mm-hmm. And that's really different from every woman. And we have to be aware as well that in the past, in the last 10 years, everything what was with hormone topics, taking hormone was like becoming taboo. And now in the last years, there have been a lot of books, publication, so Women on Fire, and if a woman feels uncomfortable or she has symptoms, she's very unhappy and she reads this book, then everyone thinks I need hormone. And for example, today I had somebody said, I've read 40 years old, I've read Women on Fire, I want bioidentical hormones, she said. Mm-hmm. And then, we are not just 0, 5, 8. So everyone has different needs, everyone has different symptoms. So there is not a receipt, a prescription for everyone. Mm-hmm. And that's the point. We have to listen to the symptom, what is making a woman being unhappy, bothering her. But of course, a bit the way that some books are selling hormones can be also a bit overinterpreted. So, for example, then they ask, should I not take testosterone? So, and then because they've read this in the book, and probably this woman who is not a doctor, she's a doctor, but she's not a gynecologist, said, testosterone makes wonder. Yes, but is a medication, we have to be aware what it means, what we should take it. So I'm absolutely open-minded and I like and love to help, but not everyone needs the same. Yeah. And not every hormone is for everyone, just because it sounds so well.
Right. And I think this is a common topic, right? It's been misinterpreted and overly cautiously considered when it comes to hormones because of very not scientifically fund studies being done on hormones and the impact of them on women's health. And now it's sort of the opposite. And people want a quick fix. They want something that they can apply to everyone and understand. And it's always more complicated. And I think it's important that you highlight something that I think is such a struggle between public health information, where it should be addressed to so more broad, and then focusing on the individual, right, where you actually look at the individual base. But I think also in a public health perspective, it would be good to highlight the benefit from individual personalized care, rather than sort of giving the same policy approach to everyone and the same protocol to everyone, just because
so that's
it's
really
easier.
Nice what you're saying, individual, personalized. So that's what should be done, and the books are a bit for everyone, and you have to pick out what is good for you. And imagine in the past, before these studies were showing some results that make rethinking about hormonal menopausal treatment, replacement treatment, it was like this, that every woman, just when she stopped having her menstruation, she just got hormones without really analyzing what are her needs. So maybe she needed more to talk and to be listened about her problems or symptoms. And then from one day to the other, everyone stopped to give hormones. And now women are also more differentiated. They know that there is the possibility to do something, but they are also informed. So the doctor who's been used to just give is in a difficult situation, because women are very aware about their needs and hormones. So you need time. So to have an individual personalized treatment, you need time, and that's what doctors don't have so much. And so women talk to each other, and then that can be some kind of danger. They say, oh, my friend is taking these tablets, I want them as well. But eventually this person is not the best for these tablets. She needs something different. So, in different area, also in the infertility treatment, not because your friend got pregnant with this tablet, you're going to get pregnant as well. So it's again individualized, is the big word of medicine today. Even in the oncology, we try to find out everyone needs a different approach.
Exactly. And I think a lot of times it's also, a certain respect towards these hormones and the impact. And if you don't know exactly what the impact is on your body, you may be reluctant to take them, even if you got them prescribed,
Exactly. And there are, this woman today was clear, she wanted hormone, and she said bioidentical hormones, and why not testosterone? And in a way, without being a bit concerned what could be the side effect of testosterone, but even hormone. So today, when you give hormones, you have to clarify which are the risks. And of course, the risks are not as high as some women want to think, but there are some risks. But the question is, what are you going to take in account to feel better, to have a better lifestyle, even to have a lower mortality? So you have to ask the doctor to explain you which are the good effects, but also the side effects. And but even here, women can be so different. Some, they don't care, they just want them. and the other, they just want to be clarified and then decide, and they prefer to suffer instead of taking hormones because of the increased risk of breast cancer, for example. And so it depends what means for a woman have a higher risk of few women from 1,000 a year compared to suffer. So everyone with their story, maybe with friends in the family or friends with breast cancer, they might react differently.
Right.
But there is one point is very, very important, is that, and I'm happy to be able to bring it here, is that many women think that bioidentical hormone is just nothing, they are helping, but they are not dangerous. And bioidentical hormones are also the hormones that we have in the normal hormone replacement treatment that we give our patients, but they've been tested. We know what the amount is there. The studies have been done, but they are also coming from the plants producing estrogen, and the doctors, the natural doctors, they prescribe bioidentical hormones, selling them as something natural in a gel form or in a tablet form that has been produced in a pharmacy, but that the end result is not being going through study. So it's not as secure as the one that we know exactly the amount. So with this, I just want to say, be careful when you just get some product that has been prepared without that you know the real amount of hormone inside.
Right. And I think that's a very, very, very important aspect, because it sort of informs on a much more deep and profound level. And it's not that one is better than the other, but I think it's maybe the emotional sort of being drawn to the thing that you feel more connected to is nature, natural, and again, the understanding the whole scientific approach is complex, right? And then we take more an emotional decision, and that is not only women taking a more emotional decision. That's everyone taking that. People who trade stocks do that too. So it's not necessarily just tailored to medicine.
The best one, and that's important, because in the emotional moment, you believe to everyone. When they're telling you, "Oh, take these nutrients, they will make you feeling very good. You will feel younger." And then in this situation, everyone give a lot of money away, so you spend a lot of money believing they are saving your life. But don't forget that bioidentical hormones, even if you buy them in the pharmacy and they have a pharmaceutical name, they are bioidentical anyway. So it means the form, the chemistry form is the same as almost as the estrogen we have in our body, but is being produced in the industrial way, but the effect is like your own hormone. Right. The anti-baby pill is a synthetic hormone. That's really the big difference. And some hormone for the hormone replacement treatment, they are also synthetic, but we have been reduced this use because they are not the safe one. So ask your doctor and get the explanation, and don't believe just anyone who is telling you these are bioidentical and there is no risk. Hormones is always hormones. And you have to be careful what you are taking, the amount, the concentration, how long. So you need to be explained to be prepared.
I think it's so interesting, because I think we used this last time already, but the analogy with radioactivity and hormones, I use this quite often because radioactivity, we can't see it, we can't feel it, we can't touch it, and it's in nature too. And the one that is in nature, we feel much less threatened by, even though more people actually, according to my friend who is a nuclear physicist and does work with radioactivity, and in a public health setting, said more people get cancer from natural radioactivity than from a nuclear power plant, Chernobyl kind of scenario, you know? And I think it's quite interesting that we are not afraid of that. And we over or underestimate the risk of it.
And that's, I think, that's very interesting what you said about radioactivity. And while you are talking, I think about the trend of planted meat, you know, which can have a good meaning of the climate. And, you know, we want to reduce the problem with the water consume and everything. But planted chicken, dependently how it's being done, can have much more salt, for example, than normal meat. So not just because it's planted, it's always better.
Mm-hmm.
And that's why as well, with hormone or with other treatment, if you say, you think, oh, the name natural, the name plant, more, as you said, herb based, it makes you feeling, oh, that's better. It's not always the case.
Right. And I think you're addressing something important in general, which is also the amount of food intake we do, how we work with our diet in parallel to the hormone supplement treatment, but also being aware, for example, of if you eat a vegetarian diet, how much tofu, for example, or all the soy products also have phytoestrogens inside, and those are also estrogens. So if you take hormone supplement treatment, you may have to consider the amount of tofu you eat. I don't know exactly, but that's something you should definitely think about.
But for example, just to come back to my patient today, you know, she was feeling the typical menopausal syndrome. Also, not sleeping well, not having libido, putting on weight. But she's 40 and her blood analyses, although I don't need them, were completely normal. And you know, we don't have to think that hormones are everything. So also your lifestyle, you know, how much you can sleep, how much you eat, how much sport you do, and we cannot attend that everything stays the same all the time. So we are getting this, we are different, our cycles are different, but you have to not expect that if you have the problem, but this is another topic, but if you are not so into sexual life, it's not just hormonal. You cannot just take hormone and then everything is back again.
Magically different, right? Yeah, but this, I think, goes back to this idea of the quick fix, right? People want the quick solution. Yeah. Now I can't hear.
No, and exactly, the quick solution is not the solution, because you always have to see every problem as a multi-factor. So,
right.
Libido is a typical example. It can be hormonal, but it could be social related, that your partner, it can be that you don't sleep enough, the children, the work, so we call this the biopsychosocial aspect. way of looking at problems. So yes, we can need hormones, but that will not fix the problem alone.
Right.
Sorry, you might hear the
announcement in that you're arriving soon, but I think it's also the sort of aware 1 minute to go mark for us anyway. But I think this was a fantastic sort of jump into a topic that we will go deeper into, and it is a good bridge between fertility treatment and also what comes after once the fertility treatments are not the part the women are struggling with or dealing with or considering.
Yes, and sometimes you had the problem of infertility, and then you go from this eventually successful or not, then you have a child, you turn 42, for example, and then when you finish breastfeeding, it starts with the perimenopause. So, it's very... And you have a small child and you just breastfeed it, and then it changes everything. So you have to be aware, not because you just have a child, you don't have the symptoms, so you have to treat it.
Right.
Or
even if you don't breastfeed, it comes even earlier, that clear cut. Yeah.
Exactly. And if you breastfeed, sometimes it makes everything different because you're like so concentrated also by breastfeeding your child, the love of the child, so you don't realize that you're not sleeping because you wake in the night, and then when you stop, even earlier or late, then it's like, oh my God.
Like a wall is hitting you.
Yes, and that can be very, very traumatic in a way because you feel like, oh, I'm a young mother and I'm having hot flashes.
Yeah.
But it can be temporary. It doesn't mean it's going to stay. So sometimes that's why it's important to observe. Eventually you need some hormones, but it could be that you need hormones just for a time.
Right.
That's why you need a specialist who helps.
And for last comment maybe in this area too is women that have been in fertility treatment for many years, they've been under massive hormone overflooding for many years. And then if you got your child or your children and then you suddenly don't get those anymore, it's like an extreme cut from one extreme of massive hormone overdose to like deprivation kind of. Yeah. And if you are already on this later stage of your reproductive cycle, meaning you're around 40 or late 30s, then it might be even more amplified. I think that could be an interesting topic to continue.
What to do, or at least be aware that you might get into this situation, and then you need help, you need to talk about it, you need the right person who is helping you.
Exactly. Super. Hey, have a good time in Bern, and enjoy the sunny afternoon, hopefully a little bit at least. And let's continue very soon. Thank you so much for your time.
And just the last word. And to have a supervision with because I'm a psychosomatic friend, and the supervisor is gynecologist, psychiatric, so it's wonderful. So I'm always looking forward to see her, and then we discuss the problem of women, how to handle. So it helped me and will help you as well when you were listening to us.
Fantastic. Thank you so much. That's really interesting.
Have a nice afternoon.
You too. And let me know how it went. That's very interesting. Wish
Bye
wish her
bye,
hi from
everyone.
me. Ciao ciao. Thank
Ciao,
you. Take care. Bye.